I actually did internal medicine before going into psychiatry. During one of my rotations, I had a rheumatologist that I did continuity clinic with, and he was awesome at treating depression and anxiety with the rheumatology patients. And that kind of perked the interest in psychiatry. I'm a consultation psychiatrist by training, so what that means is that we have added training in both the intersection between medicine and psychiatry. Mostly, we're going to be seeing patients that are referred from our medicine and surgical colleagues. So I typically see adults. I've certainly seen patients from different medical backgrounds. Probably have a specialty in cardiology patients. Patients will probably be seen first by our cardiology colleagues, and then after that, they'll detect, well, listen, this person, he or she is having really a tough time coping with a diagnosis. Or maybe they had a pre-existing depression or anxiety disorder that we know that in situations where cardiac disease get exacerbated, it gets worse. What we do is a very complete history, understand their medical surgical issues that are going on, try to dissect how these things are interwoven, and really come up with a treatment plan. I know patients sometimes are scared. I sometimes know that they may have a little bit of stigma as far as mental health. And the fact that we are co-located with them in the cardiology clinics tries to soften that type of anxiety and that apprehension to come to see us. We don't only do care of the patients or encounters on the outpatient side. We're very fortunate at the Cleveland Clinic to have a team of doctors trained like in our discipline that see people on the inpatient surgical side and medical side too as well. To have patients, oh my goodness, since residency, and this is almost about 30 years ago, seeing them grow in their family life, seeing them grow also in their medical journey. And like many of us at the clinic, it's an absolute privilege to be part of that. If we can really make a concerted effort that when we see that patient for the first time, listen to them, use our critical thinking skills, if at the end of that visit, we can look that patient in the eye and say, look, there's options. When you leave that door, we have options for you. I think that's a good day. It's very rewarding to see patients that are native Spanish speaking. I'm fortunate, my parents are from Spain. They were really good at teaching us to speak Spanish at home. Part of the Spanish genes is I'm a big soccer nut, and so, we watch a lot of soccer. I have a family, we have 3 kids, we have 1 grandkid, another one on the way, so there's a lot of activities outside of the work that keep us busy here in Cleveland.